Hello everyone, in this video we are going to discuss about DLCO. DLCO means diffusion capacity of lungs for carbon monoxide. So where this diffusion is actually occurring. Whenever we inspire oxygen, it enters the lungs and diffuses through the alveoli to the capillaries, and it reaches the tissues through the capillaries, and it is used for production of energy. So this diffusion plays an important role. So through this diffusion capacity of lung for carbon monoxide, we are measuring how easily the gas transfers from alveoli to capillaries using carbon monoxide gas as a proxy. Why carbon monoxide? Because it will bind very strongly to the hemoglobin. So what affects this diffusion lung capacity? There are four components, that is surface area. If there is more surface area, there is more alveoli, there is more diffusion DLCO. Next is alveolar wall thickness. If it is thicker, there is less diffusion. Next is pulmonary capillary blood volume. Since there is less blood, there is less diffusion. Next is hemoglobin levels. If there is low hemoglobin, there will be low binding to the gas. So there will be low DLCO. So DLCO is more in case of more surface area, it is less in case of alveolar wall thickness, less capillary blood volume, less hemoglobin. So what is the procedure? So we will ask the patient to inspire air, that is which is a mixture of oxygen and nitrogen with a small amount of carbon monoxide, which is not toxic because it is very small amount. Then we will add a tracer gas, that is methane. This tracer gas will not be absorbed, it just helps to measure the amount of carbon monoxide absorbed. So with the mixture of air and carbon monoxide in the tracer gas, we will ask the patient to inhale, and the patient will hold a breath for few seconds, and we will ask the patient to exhale. The amount of carbon monoxide in the exhaled air is measured. So the prerequisites for this test are: the patient should not exercise before the test, should not give any supplemental oxygen 10 minutes before the test, should avoid smoking at least 4 to 6 hours before the test. So the measurement is ml of carbon monoxide per minute per millimeters of mercury is measured. So normal is 75 to 140% of Richter value, mild decrease is 60 to 74%, moderate decrease is 40 to 59%, severe decrease is less than 40%. So this DLCO is decreased in cases of emphysema because there is destruction of alveoli, so there will be decrease in the surface area. Next is interstitial lung disease because there is thickened alveolar walls. Next is pulmonary embolism. Here there is decrease in the perfusion, so less capillary blood, so less DLCO. Anemia, in these cases there is less hemoglobin which is binding to the carbon monoxide, so less DLCO. And in smoking also there is less DLCO. Next, DLCO is increased in cases of pulmonary hemorrhage because in hemorrhage there is extra blood in the alveoli which absorbs more amount of carbon monoxide. Polycythemia because it have more hemoglobin, more carbon monoxide uptake. Asthma because there is increased pulmonary blood flow in acute attacks and also in pregnancy. So we can remember by the mnemonic EPIA for the decrease in the DLCO, like emphysema, pulmonary embolism, interstitial lung disease and anemia. PHPA for increase in the DLCO, that is pulmonary hemorrhage, polycythemia and asthma.